When patients undergo certain types of injuries or surgery, they will need to be put into a fiberglass cast or a plaster splint. Plaster splints are designed to be a rigid support over the back half of the leg and the bottom of the foot. They're designed to allow for swelling and expansion of tissue during the swelling so that the circulation is not cut off. Fiberglass casts are full foot and leg rigid supports designed to immobilize and stabilize the foot and the leg. The most common use of fiberglass casts is from an injury like a bad sprain or a fractured bone.
To place a plaster splint on the patient, you will need to properly position the patient. There are two common positions depending on the reason for the splint. The first is the prone position. Prone is when the patient is on their stomach with knee bent so the foot is in the air. The second is the supine position, where the patient is on their back and the leg is lifted and the knee is bent in the air. Move the patient into one of these positions. You will need stockinette placed over the patient's foot and leg and many rolls of web roll or cast padding, probably as many as 4 to 5 rolls, depending on the padding the physician wants. You will then need to get 15 strips of splinting plaster, like the kind used for custom orthotics, and put them into 2 piles, one of 7 and the other of 8. Draping is important during splinting because there will be a lot of water and plaster drips. You will need to provide drape coverage with chucks so as to make the cleanup much easier for yourself and to ensure the patient's clothing is not splashed. The physician will be the one placing the splint, but you will be assisting him by holding the patient's leg. To do so, instruct the patient to bend at the knee and relax their foot. You will need to hold their foot as close to 90 degrees as possible. So, to do so, hold the 4th and 5th toes or put pressure on the ball of the foot. Hold still while the splint is applied. After the stockinette, web roll, and plaster is applied, you will need to have 2 ace bandages ready and a piece of tape. The tape will hold the web roll down and the ace bandages will wrap around. The physician will take over holding the leg and then you can begin cleanup. Make sure the plaster splint is dry before discharging the patient. A splint is rigid enough to hold the ankle and foot stable, but it is not made to walk on, so make sure the patient understands they are to be non-weight bearing until they follow up and are reevaluated. A fiberglass cast is much easier for the physician and assistant. Depending on whether or not the patient will be weight bearing or non-weight bearing, you will need to grab the proper number of supplies. Your physician will let you know if the patient will be able to walk or not. The supplies you will need are stockinette placed over the patient's leg and foot. Make sure to allow for folding room, so it should be up to the middle of the knee and should stick off the toes about 2 to 3 inches. 3 to 4 rolls of web roll to create some padding within the cast, and 3 to 4 rolls of fiberglass cast splinting in the color of the patient's choice. Make sure you know what colors we have in stock so you can give them proper choices. You will also need to have 2 tongue dispensers to create room in the side of the toe box for the cast, if the doctor desires. You will place the stockinette on the patient's foot and leg and raise the chair into the air. There is a casting stand that will be used to put the foot in the proper place. Place it under the stockinette and the foot on the stand. Have the patient move forward as far as they can without falling off the chair, and adjust the stand so they are in a perfect 90 degrees. Place chucks on the chair with tape so the fiberglass does not stain the chair, and place another chucks under the foot around the stand. You will then place all the supplies with a basin of water at the foot of the patient, and they are ready to be casted.